As president of this Congress in Peru, do you think hypertension and cardiovascular diseases are increasing also in Latin countries?
Yeah, in Latin America, cardiovascular disease is increasing in prevalence and severity. And there is also a specific peculiar aspect which is characterized in Latin America. And this is the availability of people living in different cities at different altitudes. So hypoxia becomes an additional factor that might influence the prevalence and the severity of cardiovascular conditions.
What are the effects of high altitude on cardiovascular health?
As you may remember, we performed a number of studies over the last 13 years focusing on the acute exposure to hypobaric hypoxia at altitude. We collected data in the Alps, in the Himalaya, and in the Andes, and we found that any acute exposure is associated with an increase in sympathetic activity and blood pressure. And also this is associated with oxidative stress, endothelial dysfunction, and metabolic changes. Now the big question is, what is the situation in people living permanently at high altitude? We do not have a lot of evidence here. There are some studies mostly focusing on pulmonary circulation and chronic pulmonary heart disease, but very little information is available on blood pressure and cardiovascular risk, and the data on blood pressure have been collected always only using blood pressure measurement by the doctor at rest, which is not reflecting properly the impact of hypoxemia. In our studies, we did use ambulatory blood pressure monitoring, and we found quite a greater increase in pressure as compared to the resting condition. So what we aim at obtaining in this study is a more detailed picture of the situation in people living at different altitudes, comparing sea level and altitude from 2,000 to 5,000 meters, and see what the effect might be on blood pressure, cardiac function, oxidative stress, and vascular properties, metabolic conditions. We also want to study some genetic and epigenetic aspects because we believe that this might translate into the possibility of offering a better health in these people. Probably they need to cope with the lower availability of oxygen to improve the cardiac performance and reduce the risk of cardiovascular events.
Oh. Well, in conclusion, this Congress is the first international Congress about these themes.
Yes, we did previous meetings on the acute exposure. There have been some events on the chronic pulmonary disease, mainly in Peru. They are very expert investigators in this regard, but the attempt to provide an overall assessment of the cardiovascular risk, including all these different parameters, is probably going to be assessed for the first time in this meeting and in the study we have planned to perform in these countries.
Thank you very much, Professor.
Thank you.